Welcome to our Connect to Congress. We are joined today by Congressman Jack Bergman from Washington, D.C. Congressman, thank you so much for being here and talking with us today. Let's get right into it. President Trump just approved $50 million in FEMA public assistance for northern Michigan counties impacted by that historic late March ice storm. So how exactly will this funding be used, and how far will this initial $50 million go in terms of any actual community impact?
Well, number one, we're thankful that the president, through all the efforts at the White House, finally did the approval yesterday. $50 million is a start. That's the good news. The majority of that money, though, will go just to the counties affected by the ice storm. What we need now, and we're working with the president and the White House and any other, interested party here in D.C. to increase that number that's going to really go to where it's needed most, which is the co-ops, the farmers, all the folks who suffered directly from the ice storm. And we're going to need more in that federal declaration. And so we're working right now with the president to up that number. But the $50 million is a start. We just need to make sure now that the money that does come in that $50 million is wisely spent by the counties and not accidentally put, into other areas that were not related to the ice storm. So it's about managing the emergency funds coming to you.
So each county will get to decide how that money is used?
Pretty much, because that's the way the money will come out, the first $50 million. We're, if you will, trying to make sure that as we push for more money, that it's directed directly to, again, the co-ops, the farmers, the other entities that are more the, if you will, the business sector of it. Because let's face it, co-ops provide electricity. We need to make sure that those co-ops stay in business so that our residents have all the services they need. And those co-ops were hit very hard financially. That's why we're pushing for that next tranche to go in that direction.
And recently, you introduced bipartisan legislation to increase veterans' access to non-opioid medications. How exactly would the No Pain for Veterans Act do that?
Well, basically, it just requires the VA, through all of their pharmacies, to make sure that there is that customer understanding that there is these prescriptions that are being provided are non-addicting, and requiring all VA-related pharmacies to enact that, because we know that we have an opioid addiction in our country and have had it for several decades. And this is just clarifying for and through the VA that especially any veterans, are not going to be subject to addicting medications. But it's more getting the pharmacies in line with the procedures required to ensure that there is no accidental prescribing of opioid compounds, if you will, that lead to, in so many cases, addiction.
Sure. And as a veteran yourself, how do you view the importance of non-opioid pain management options for veterans, especially in rural areas like northern Michigan?
Well, let's face it. We have, especially in northern Michigan, with the rural and remote areas, our veterans have to do a lot to get their health care and to get their meds. So when you really have to put really airtight rules and procedures for filling those prescriptions so there's no mistakes made. No one wants to become addicted. But at the same time, through the education, through the VA health system, of what it means for pain management. And pain management is done in different ways. It's not just through a pill. It's through a combination of diet, exercise, all sorts of things. But we as a country became too lax during the big pharma time of Sackler and OxyContin for decades, that we took the easy way out, and now we've had too many people pay the price for bad U.S. policy when it came to managing opioids, and the requirement on doctors and any healthcare provider to the requirement for them to manage and prescribe for pain as opposed to some physical ailment. And that's where we slipped as a country a few decades ago, and now we're trying to pull ourselves out of that hole. And we have to, for the health and welfare of all of our citizens, I'm specific here in my role on the Veterans Affairs Committee, to do the right thing for our veterans and their families.
And sticking with healthcare, a lot of folks in northern Michigan are concerned Medicaid cuts in the recent federal budget would have a large impact on rural hospitals, where a large chunk of their payments come from Medicaid. So what is your message to your constituents who are worried about this?
My message to the constituents are, those who Medicaid was designed for, not Medicare, Medicaid, those vulnerable populations, they have absolutely nothing to worry about, because when their eligibility, if they remain eligible, they're going to receive the medical care, the treatment that we guaranteed them through the Medicaid program. Whether you're in a city, whether you're rural, remote, sometimes it's going to be delivered differently as we go forward here. Now I'm talking about healthcare delivery, actually, whether it's Medicaid or not, which is through different ways of doing it. One of the things in the advancements for the rural and remote areas is telehealth. And as we advance care in the community as relates to telehealth, and then tying back into larger, bigger hospital areas, let's say whether you're in Marquette or Iron Mountain as opposed to Ontonagon or, Manistee. This is going to be a positive change, I believe, in the rural and remote areas, especially in the 1st District, for better delivery of healthcare services to especially our vulnerable population.
And switching gears now to a story that's been making headlines around the country the past couple of weeks. Some lawmakers are calling on the Trump administration to release the Jeffrey Epstein files. How do you feel about this? Do you think the files should be released?
Well, let's put it this way. I believe that President Trump is making the right decisions. He is doing everything he can to ensure that we have transparency. So if you want to ask what my basic belief is, I believe in transparency at all levels of government, that's who we are as a country. And under President Trump's leadership to push this forward, we're going to get the transparency that the Americans want.
Is there anything else that you're working on in Washington, D.C. right now that you want people in northern Michigan to know about?
No, just the fact that I just literally walked out of a Veterans Affairs Committee markup, where we marked up several bills today. The Access Act in particular, that was the name of the act, sponsored by Chairman Bost, that is going to move forward with the requirements on the Veterans Administration to provide the services, whether it be health care, whether it be you name it, for the veterans, that is going to make our area, especially here in northern Michigan, a better place for veterans and their families.
All right, Congressman Bergman, thanks so much for joining us here on Connect to Congress. We really appreciate you and your time.
Thank you.